graph here, I adjusted the population of Idaho, South Dakota, and Sweden to be the same as Nevada, just so that we're not saying, well, it's not happening because, their population is different. We are still worse than them, even though we've completely locked ourselves down and destroyed our economy. So here's where I'm going with this. Worst case scenario, based on actual statistics, what has happened right now. And I want to read this. We shut down White Pine County and destroyed the greatest economy in human history based upon someone's best guess without any real stats. Therefore, I do not believe that my projections based upon actual stats are somehow unrealistic or overly optimistic. So here's the deal. If every man, woman, and child in White Pine County became infected today, 8,000 of them would never even know they were sick. 2,000 would experience symptoms, and 100 of them would need to be hospitalized. And 5 would be in mortal danger. I'm not trying to downplay people getting sick or people dying. But in 2018, over 1,500 people in Nevada died of accidental death, yet we went on living, driving, building, flying, playing. Anytime anyone dies, it's tragic. But ceasing to live and inflicting criminal levels of mental abuse on our population by denying them human contact and interaction is, in my opinion, absolutely insane and irresponsible. Regarding masks, let's recap this. There is no law. The governor is operating outside of his authority. No ands, ifs, or buts. Masks are an act of compassion. If a mask is an act of compassion, well then everybody needs to start wearing them 100% without modification. No more dangling it around your nose, dangling it from your ear, pulling it under your chin, taking it off to speak. If it is really that big of a deal, then that thing better be glued to your face anytime you're around other people, if that's really what you think. Otherwise, let's have the guts to not wear it if we know it doesn't work. If you find them uncomfortable or impractical, such as making it difficult to understand when you speak, then join the rest of us in standing for freedom. But if you're going to insist on the rest of us wearing a mask and sitting and citing compassion, then set the example and wear a properly fitted N95 correctly at all times. The science is not settled. For every one study or official you can point to presenting and present that claims masks are an effective measure, I can find five more to the contrary. Regarding OSHA, there's been a lot of rumors about what they're enforcing and what they aren't, and I'm going to acknowledge that this guy could have been blowing smoke, and if he was, then we need to hold him to it. I called OSHA. I spoke to a high-up representative about this situation. He said, this is what he told me. They expect businesses to do what is reasonable to protect their employees and their patrons. They do not expect employees to confront patrons about not wearing a mask because that puts employees in a dangerous situation if a patron becomes belligerent. If they see a violation, they're not pulling out their ticket book and writing people up on the spot. They are pointing out whatever violations occurred, which could be a variety of things. OSHA's got some crazy rules that probably half this town is violating all the time. So they're supposed to be sitting down and making a plan to address those things. And then if they're not addressed, that's when the fines start coming out. So if we start hearing, we'll stay, keep with the district attorney's office, if we start hearing about businesses getting fined specifically because a customer didn't wear a mask, that's the one I care about the most. We need to be maybe working as a county to see what we do to help them because according to OSHA themselves, when I call them, that's not happening. So in conclusion, stopping the spread is impossible. The people are going to Sturgis, cases are going up. It is going to happen. This is reality we're in. It's an infectious disease. but it was never the goal to stop the spread. And we now know that the death rate is statistically too small to justify anything but life as usual. Having enough hydroxychloroquine with zinc supplements on hand will allow us to quickly treat and likely cure all hospitalized patients, and will adequately deal with the risk to our population. I believe as a county commission, we should take the following action. Number one, we should stop wearing masks in our meeting and stop requiring participants to wear them. If they want to wear them, it's up to you. But we got to stop this requirement. So. Number two, remove all mask requirements that we as a county commission have implemented and allow our department heads to make their own policy that they feel is appropriate. Number three, we need to work with the DA and other relevant parties to protect our local businesses from fines and prosecution for violations of erroneous regulations from the state or the city of Ely. I've got business owner friends that have been getting letters from the city of Ely threatening $1,000 fines, and some of these people are some of the most compliant businesses in town, and they're getting threats for $1,000 fines from the city of Ely. Unacceptable. I believe as the health board, we should direct the hospital to have adequate doses of hydroxychloroquine and zinc on hand so that they are ready to use for treatment of patients experiencing extreme symptoms. And I understand that some people think that's a controversial thing, but what are we told about masks and all the other dumb crap we've done so far is if it saves one life, it's worth it. Well, a medication that's been used safely for all kinds of other things that has been proven to treat this disease, if it saves one life, maybe we ought to do it. So that's my perspective. I sat quiet for a long time. I wanted you guys mostly to just understand why I feel the way I feel and why I do what I do. It's not just out of belligerence, it's not out of rebellion, it's not out of just sticking it to the man. It's because I have analyzed the data and made an intelligent decision. And I respect your guys' perspective that might differ, but I want you to know where I stand.
I appreciate and respect the real work you put into bringing us all these statistics and everything else, and your opinion is your opinion. This is a discussion update, but I do respect your opinion and your right to an opinion. So we're going to move on. Was there somebody on the phone? We're not in public comment anymore, so we're just not going to allow public comment right now. Mr. Bullis was allowed to voice his thing. I thought the proper time to do it was before we get into public health. And thank you for your update. We all have the statistics. You've all heard this. You can form your own opinions, whatever you'd like to do, just as Mr. Bullis did. Appreciate it. Thank you. So with that being said, that was an update. We're going to go back into our regular meeting and the timed item, which was a 9:15 on page 2. Excuse me. Item 1, 9:15 is interviews for public health officer. Item 1 is discussion for possible action to approve. Let's see. How do we got this here? Approval to review or current applications for public health official and to determine if additional advertising is necessary. So Elizabeth, why don't you take the lead on this? And we have 2 candidates, am I right?
Yes, you did receive 2 resumes, and they are in your backup materials. Both of them, pursuant to my understanding of statute, are qualified candidates for the position. You can proceed with the interviews or decide if you want to wait and get more applications, given the current situation of being in the middle of a pandemic and not having a public health officer. I would encourage that we at least interview these 2 candidates today and then determine after the fact whether you feel one of them is appropriate or you want to advertise further. That is always a decision, but you do have the 2 applicants.
I think you're correct. We've asked these gentlemen to show up here today. They're professionals on their own time. We owe them that right to be interviewed. Mike, should we allow them to have an open interview, or should we just, how should we go about this? Should it be closed? Should they have the option?
first of all, are we still on one? Are we still reviewing
Yes.
applications?
Yes.
All right, so if we're still reviewing applications, we're not at number 2 yet for interviews. When it comes time to interview, it's an open meeting and we can't exclude them. We can ask them to step outside while we conduct the interview. They don't have to leave.
Okay, then I'll look for a motion to approve, to review the current applicants.
If no motion is necessary,
No
you
motion
should
is
discuss,
necessary.
or just review the applications. And someone can make a motion for additional advertising. Okay, that's kind of how it's written. Or no motion, and you just move right to interview the applicants.
So call for a motion.
I can ask for a motion to
Advertise.
advertise if necessary. Do I have a motion? We have two qualified applicants, I believe. So do any of the board members think we need to advertise for more? Or are we okay with going ahead and interviewing the applicants that we have?
I feel like we won't know that until we interview them.
Well, this is to determine should we go into advertising anymore. Do I have a motion for that right now? Before I go into item 2, I'm gonna ask one more time for a motion to see if we need to do additional advertising. Am I right, Mike? Am I doing this
Yeah.
correct?
It's fine.
Okay. Do I have a motion? I'll ask one more time. Do I have a motion? Hearing none, seeing none, we'll move on to item 2. What do I say there, Mike? It just died for lack of motion.
Yeah, just dive like a motion. You can always put on the next agenda and bring it back. if
Okay.
necessary.
Item 1 dies for lack of motion. Item 2, page 2, under the 915, is a discussion for possible action to conduct interviews of candidates for the position of public health officer. We have 2 candidates, Mr. Robertson is one, and what's the name of the other guy? We should do these,
Coons,
what's the name?
K-U-N-Z.
Okay, so we can do this, let's just do it fair, we'll just do it alphabetically. And Mr. Coons, you'd be first to come forward. Our HR person's gone, so our finance director's listed some questions for each one of you. You can do this in a public meeting, or you can ask for, is the other
No.
candidate here?
It's an open meeting,
It's
so
open.
we'll invite Darren to come up, and then, because it is a type of an interview, we can invite Mr. Robertson to step out, but he doesn't have to as well, you can stay if you'd like.
And for the record, I wanted to state it that even though as the finance director, she does have a background in human resource.
Yeah, and we've done this process before.
We want to take care of this. Sir. Okay. Thank you. So at this time, I'm going to turn this over to Elizabeth Francis, and she's got a list of questions. We all have a copy of that, and we can read them as we get them, so you all have received, you all got your copies
Mr. Coons,
of
I
the
need a copy
questions.
of what you handed out to the board, please, thanks. Or is that your only copy?
Shane, you guys got this?
Yeah,
Ian?
Yep.
Okay, so we're good.
Oh,
There's
then
one
you
for each
shouldn't have
candidate, so
both.
as we go through Dr. Coons will be first.
It's already out there.
Yeah,
Okay.
we've got
That
this
whole,
in our backup.
unemployment,
So Dr. Coons, Elizabeth will address the questions to you, and you'll give her a response.
Thank you, and we just have some questions we'd like you to answer, and I would like you to direct your answers not to me, but to the Board of County Commissioners, please. So your first question is, tell us about your background, education, and qualifications to be the White Pine County Public Health Officer.
Certainly, so, as you be aware, I'm the clinical pharmacy director for our hospital. The pharmacist, you know, a doctor in pharmacology, of course. I explained this a little bit at our previous meetings. I'm a PharmD, pharmaceutical doctorate, where MD is a medical doctorate. Spent the last 6 years in White Pine County working with every physician in our facility. There's not a day, as I've stated before, that goes by without my recommendation being sought, or my opinion, or being asked to research and provide information to providers and help make decisions in patient care. So I feel that's my education background.
Okay, and describe what you believe would be the main priorities or objectives of the White Pine County Public Health Officer.
That's great. After Commissioner Bolus's statement this morning, that's a loaded question. What direction are we gonna head? What are we gonna do? Is the governor gonna withhold funds? You as a commission, I guess, need to decide how you're gonna proceed. If you're gonna do what the governor's asked, what the CDC's looking at, World Health, it's really what direction. My personal feelings are, we need to keep going. I don't agree with all the statistics that were shared. I can tell you, I think public health is an important venue in our area. We don't probably have enough of it. Just because this crisis came about doesn't mean you don't need a public health officer. There's sex education in our schools. There's diseases that are being spread, communicable diseases. There's health and welfare of our community that from being more assertive and more active as a public health officer in providing immunizations and educating young families on the importance of health, working with other providers. There's many options that I think our public health officer should be addressing, however, we have not ever addressed. We've mainly just kind of been at home, yeah, he's our public health officer, great. But, you know, we've totally paid him in the past, which is fine. But I feel like this county deserves better and deserves more. We need to have a public health officer who's actively educating and pursuing what's best for this community. Whether that's through education and outreach or through helping you as a commission understand what's going on. I do commend Commissioner Bolus in taking the time to do his research. There is a lot of questions when it comes to COVID-19. We are not a medical science. I repeat, it's never been called a medical science. It's always been called a medical practice. We practice medicine. We do the very best with what we know how. As a county health officer, that's what I would do. I would do the very best with the knowledge I can gain, the articles I can read, relying on the experts that I talk to. And you're right, you talk to one expert, he's gonna have an opinion. Talk to a different expert, they're gonna have a different opinion. Again, it's a science, it's not the case, it's a practice. We're trying to do our best that we can to help people survive in the best manner that they can. Does that mean masks are effective? Well, we have Dr. Magosa in the back, here he was, he's still here. He's a surgeon. He throws a mask on before he does surgery and he scrubs in. Why? It prevents spreading infection and illness. As you lie on that table and you have an operation. I can't tell you 100% the mask is going to prevent you from spreading this disease. But I can tell you there's a lot of research out there that it helps.
I have a quick question. Were we going to ask the applicant to leave the room?
We did?
I did.
Oh,
We're okay.
okay, I'm sorry.
Okay, how do you propose to balance the medical needs with other public needs during the course of the pandemic?
It's a great question. I think we need our economy's struggling, our businesses are struggling, our citizens are struggling. There's a way to have activities and still be protected. Does that mean we as a county need to provide more hand cleaning stations? Great, let's do it. Does that mean we ask people to wear a mask if they're in a large gathering? Yeah, let's do it. And so I think there is a way. Our jerk reaction should not be to shut this town down. It shouldn't be to shut an event down like the horse races that everybody's so fond of, or we were able to have the rodeo and fair this last weekend. Not a lot of people had masks on. Does it offend me? No. Does it concern me? Yes. I would love to see more masks. And still have the event, mind you. I think that's important. So I think there is a delicate balance there that can be achieved. We should be able to protect our health, but still enjoy life and our freedoms. That's a big key. We are free. We're free to choose. Now, the problem is, the governor's free to choose too. Law, mandate or not, if he's holding funds at a ransom over our heads, can we afford to ignore him? Can we afford to say, we're not gonna do it, we're not gonna follow it? Our county's not gonna participate. Oh, well, there goes your funds. Legal or not, I don't think our district attorney wants to be tied up in a battle the next 10 years over a couple $1 million here and there. But I could be wrong. Again, that's you as a commission's choice and direction, if given this opportunity. I hope you have a direction for me that says, go and do the best you can for the public health with the knowledge we've been given. And if that's not the case, I understand.
Thank you. What resources do you anticipate you will need to perform your job during the term of the pandemic and beyond?
Resources, financial resources are a must. Not only for my personal salary, or whoever you choose as salary, but you should allow some funds. I know its budgets are tight. You're always struggling to find money. We need some money. You need some education. You need posters in schools. You need young parents coming in to see the county health nurse, the county health officer, and discussing immunizations. We need money to go for training. You need to send your county health nurse to public trainings and things of this nature that will then ultimately come back and benefit us as a community. Any knowledge is good knowledge. And we need to have the money that, not asking for millions or hundreds of thousands, maybe $5,000 for education. We can put out some mailers, we can jump on our Facebook feeds, we can offer some things. But at the end of the day, we can't have criticism coming from you as a commission. I need you to support us. You might not agree 100% with what I'm doing, and if that's the case, great, pull me aside and talk. But you might not agree that immunizations work, that's fine. But the science says otherwise. The statistics say otherwise. And so, I guess that's my point. We need a few funds in this community just to do a few things with. Start small. What can we do for free? Great. Okay, that's working. Let's go next. Maybe a couple ads in the paper. Great. It's going to cost us a little money. What are we going to do? Oh, hey, let's go to the school and we'll talk to all the kids about the important, the high schoolers as they're leaving, the importance of getting vaccinated for different diseases they're encountered possibly in high school or in college as they live in dorms and things of that nature. So there's a lot of things I think we can do with some limited funds. However, it's not free. My time's not free. Your time's not free. You still need to have, at the end of the day, some money set aside to pay these individuals to go out and to improve the health of our community.
Thank you. What is your expectation of the Public Health Board during the term of the pandemic and beyond?
The expectations of the health board. I guess to set a clear expectations would be that you set a clear point of view and a concise direction in where you're headed. It's going to change over time. I think Mr. Bowles pointed that out. It's changed rapidly over time. Back in February of this year, I happened to be in California, attending a woodworking conference down there. I'm a woodworker on the side. And great class. That's beside the point. The point is this. I was with an MD, our director of emergency medicine at the hospital, and myself were in this class. And people asked us, what do you think of this coronavirus? Is it going to be a big deal? You know what my opinion was in February? It's not a big deal. More people die of the flu every year than does this coronavirus. Let's see what happens. I distinctly remember everybody in that class wanted to hear what myself and Dr. Barnett had to say. It's changed. It's changed from that. So, will it change 3 months from now? Yeah, it's gonna change. So as a public health board, we need to do the best we can. Look at statistics, look at the directives, and just try our best. Again, it's a practice, we're gonna try our best. Things have changed drastically since that class in February. I would have never believed that I'd be standing in front of you today, wearing a mask, looking at people that are sick, storing drugs at the hospital that may or may not ever be used, increasing my overhead there, just in case our population needs it. It's been an incredible journey this last 6 to 8 months. I think you guys can agree with that. Every person in the world has been impacted by this, for good, bad, or indifferent. We're all, so as a commission, we need direction and we need to stand together on how we're gonna proceed.
And I'd like to invite the county commission if they had any follow-up questions on any of the responses given. Otherwise, that is all of our interview questions for you today. And I'd like to thank you for being here, and I would like to.
Do I have time for questions of the board? As the candidate?
Yeah.
Sure.
What direction are you gonna head? Do you know? You got, Mr. Bowles presented some great information. You all need to digest. What direction are you gonna head?
Well, we're gonna rely on the experts, yourself or whoever the public health officer is. Dr. Young led us on a good path, but we're all novices. None of us are doctors here. None of us have a background in medicine. We're gonna rely on our public health officer to direct us. So you ask for what direction. None of us are medical experts in any way. So the person we put in this position to guide us, to help us along the way, and although we're all gonna have different sort of opinions, whether we like something or whether we don't. But this is why having a public health official on board is so important to the citizens of White Pine County, is for them to give us direction. And if we go with some, one of the other items that's coming up on the agenda for some input, that so be it. But we need, the direction we're gonna take is what we can hear from the scientists that we see on TV, what we get from our public health officer, what we're getting from the hospital. These are things that, this is where we're gonna get all our information, and we're gonna base our opinions, or at least I'm speaking for myself, and I hope I'm speaking for most of the commission. You asked me what direction we would take. You're gonna give us the direction, and I think we're gonna do the best we can to follow that. And, Travis?
Yeah, I mean, where I see it is, you bring us forward the information, and then it's our job to vote and make a decision. We weigh your expertise and legislative and freedoms, and then that way, it's on us. So, you presented the information, we voted on it either way. We're the elected officials, you're appointed. It should come to us that are elected by our constituents. So if we choose wrong, it's on us. If we choose right, it's on us. And that way, at least take some of it off you, because, you're solely in this niche as a medical professional. And then we can take yours and, freedoms, what we think is right, and then the vote goes as it is. So that's my opinion, is how we need to handle this, is no one goes rogue. It's just bring it here, hash it out, the decision's a decision.
I appreciate that, Mr. Doe, and Mr. Allen, thank you. Appreciate that.
I agree with that completely. Our mission is to utilize the information that you bring to us to make those decisions educated.
I appreciate that. I appreciate that. I can tell you that if you choose to go with me, I'll work hard, do hard. Been talking with Matt Walker, talking to Negosa. I think you'll find that there's recommendations out there that I can do this job. I do appreciate your time. If there's no further questions, I'll be done.
I actually do have a question for you. If the pandemic disappears tomorrow, what do you foresee as our priority list as a public health board beyond that?
I think it's a great question. There's a lot of public health. I wonder how much education is out there with, my own kids are in school here. There's not a lot of education with health. Hey, let's not get into the sex ed stuff, that's, wow, I don't even want my own kid in that discussion, I'll have that discussion with my son and my daughter. However, STDs are rampant, kids need to be aware.